Good morning, good afternoon, everyone. Welcome to our second day of the 5th Annual Conference on Child Behavioral Health in Sub-Saharan Africa. My name is William Bianci. I'm a doctoral candidate in social work at Washington University in St. Louis. It's my pleasure to welcome you to the second day. Josephine, my colleague, and I will be your MCs. For those of you joining us for the second day, and those joining for the first time this morning, we thank you and we are deeply grateful. Thank you so much for being with us on this online platform. I'm going to allow Josephine to introduce herself and also give us some housekeeping notes. But before she does that, I would also like to acknowledge our colleagues and collaborators. This conference is hosted by Smart Africa Center and the International Center and Development here at the Brown School. We are also grateful to our colleagues at the National Institute of Mental Health, as well as our colleagues at Opening Classroom here at Washington University in St. Louis. Josephine.
Thank you so much, William. My name is Josephine Nabainda, and I'm the study coordinator at Smart Africa, Uganda. And I'm also an incoming PhD student at the Brown School in Washington. I'll be the co-MC with William, and I'll be taking you through our housekeeping rules. Just like yesterday, we shall also make sure that all participants will be kept muted in listen-only mode, and cameras will be turned off. Please submit questions via the Q&A box anytime during the presentation. If you have any technical difficulties hearing or viewing the webinar, please note this in the Q&A as well. You can also email lpia@wiso.edu. We're also live at YouTube channel, and the link is given as you observe it in the screen. Thank you so much. William.
Thank you, Josephine. Now it's my honor and pleasure to introduce to you my Dean, Dean Mary McKay, the Dean of the Brown School at Washington University, to offer her welcome remarks. Dean Mary McKay, thank you.
Well, thank you, William. Thank you, Josephine. Good morning, good afternoon, good almost near evening to many of you. It is my just privilege to welcome you back to day 2 of our 5th annual conference on child behavioral health in Sub-Saharan Africa. Now, I have to say that those of you that like me joined yesterday, I was completely inspired by the important work that is being done across country contexts with a whole range of collaborators really pulling together to use science to improve the life of children, their families, their communities. I really want to just say that from the words of Chancellor Andrew Martin at Washington University in St. Louis to Dr. Joshua Gordon, the director of the National Institute of Mental Health, to the panelists that really describe the important scaling work that is happening on behalf of children, the important research innovations that are happening. And so I'm completely looking forward to day 2. I want you to know that even though we are not together, the participants here on YouTube, across country contexts, we are together. These pictures on this slide that William has just put up shows the numerous colleagues that are watching from our site at Washington University in Uganda. And I know that our colleagues around the globe are also watching. So welcome to all of you. Thank you to all that you do. And we're really excited to launch into day 2 of our conference. So William, if you advance the slides for me, I'd appreciate it. So Dr. Fred led off day 1 by letting you know what our objectives are. And the next, so if you'd stay right there, William, on the objectives, that would be awesome. And so I just want to, emphasize a couple of things that Dr. Fred said to us. This is an opportunity to hear from a range of stakeholders about findings, also to hear about experiences from the various innovative interventions that our colleagues are creating and then testing. And what's so important about this particular conference is the South to South collaboration, because really what we wanted to foster in Smart Africa, whether it be in our scale up research, our capacity building, our policy making, is to really be a support, and that there be a true bi-directional exchange, so that the global South is more and more in the lead of these interventions with support from those of us at US-based institutions. And I believe that if we're going to accelerate progress in the area of children's health and behavioral health, we need more and more of us in the game, but particularly support for Global South investigators to take the lead in this type of research. William, next slide, if you will. So as William tries to advance the slides, he's just going to show you what you already know from the electronic program, that we have a terrific set of colleagues that are going to present. So in a few moments, I'll introduce our Vice Chancellor for International Affairs, followed by, we are so grateful to have real program leaders. In this case, our program official from Fogarty International Center. We're so grateful to hear some leaders in this space, as well as panels of colleagues. So our colleagues from Kenya, our colleagues from Ghana are going to talk very specifically about their work. And then Dr. Fred and I will come back to end the day around 11:30. So with that, I want to once again enthusiastically welcome you to the second day of this conference, and also express my real gratitude for Dr. Kurt Dirks, our Vice Chancellor of International Affairs at Washington University in St. Louis. And Kurt, like many of us at WashU, we wear multiple hats. So you have a Vice Chancellor role and a real leader in our international teaching and research. You also direct the McDonnell Academy, a support for scholars around the globe to advance in their education and leadership. And a true partner with those of us that really have centered our research, our teaching on the African continent. I do want to just say, Kurt has a distinguished academic career, and you can read about that in the electronic bio. But what was most important to us at Smart Africa is when you joined us, when you understood the importance of the work, you expanded the number of partners on the continent and are committed to doing that and more. That's incredibly important. And so under your leadership, Makerere University is now a core part of the McDonnell Academy. That's mission critical to the work that we're trying to accomplish. And we look forward to working with you to expand the teaching and learning on the continent even more. So with that, Kurt, thanks for doing some remarks, and I'll come back to thank you afterwards. Thank you.
Well, thank you, Mary, for the gracious welcome. And hello to everyone from across the world who are joining us today. It's a pleasure to be here to share just a few thoughts and remarks at this conference. So I'll be quick, but I just have a couple of messages. The first one is congratulations on putting together what sounds like an extraordinarily inspiring and important conference that you're doing on a very important topic around children's mental health and behavioral health. Obviously, one of the issues which is very challenged these days, and very challenged in multiple parts of the world, and not only in Africa, but in the US and elsewhere. I know it's difficult to do these types of events virtually, but I'm glad that you pushed on. The second message I would like to share would be just where Washington University sits on the international space. You may have heard this from our chancellor yesterday, and I'll reemphasize that. Obviously, the past several years have been extraordinarily challenging for international work, some of it from political reasons, and then obviously from a global pandemic. And I think many of us who work in this space wondered, is this going to stop? or really halt international work, research, and education. And at least here at Washington University, just like this conference, right, we have pushed on. And in fact, this year, we may have a record number of graduate students from international graduate students here at Washington University. So we are deeply committed to that because we know those students like William, like Josephine, like others, bring both tremendous talent to Washington University and a great diversity that all of us need to make the world a better place. Second, on the research front, we also know that much of the really important work requires collaboration from people across multiple countries. So you're bringing together people with the most expertise and most talent to solve important problems like like mental health, kids' mental and behavioral health. And so we are committed to this. And so after we can get back together again, I expect that things will continue to pick up and accelerate. And we'll look forward to being back on the African continent, I hope, for one of these conferences very soon. The other issue, so that was my first message about Washington University. And I would like to give you just a couple of examples that those are not just words, but we really are deeply committed to this and committed in a way which is about partnership and collaboration. And I think Dean Mary helped to set those words up nicely on that. So just a couple of examples, and I will, in fact, I'm just going to share 2 slides. I'll be brief here. 2 slides on this. One is, if you pause, give me 1 minute to bring this up. One is, and hopefully you can see my, I'll make sure you can see my slides here. One is about what Dean Mary called, which is one of our partnership networks, which we call the McDonnell International Scholars Academy, and our partners in Africa. I have partners in red because that's what we really believe that these relationships is true partnerships. We obviously, our faculty work in all different kinds of places, all different universities, whether it's on the continent or other places throughout the globe. And but we've identified a few which we're trying to build particularly deep relationships to help students and to help foster research. The 2 partners that we have in Africa are the University of Ghana and Makerere University, where obviously Dr. Fred is our leading ambassador, as we call him. The Academy really is intended to help advance our education mission, in part through what we call a scholars program. So for students who want to study in the United States, and we offer a special program if they enroll in one of our graduate programs, such as perhaps a PhD in social work. And we offer not only financial assistance, but provide leadership training and bring them together with a community of scholars from across the globe and across disciplines. And so this year we have about 20% of our students are from Africa, but they're in all different disciplines. One's in business, some are from the Brown School of Social Work, one's from engineering, one's in cancer biology. And so it provides an extraordinarily enriching community, both culturally and intellectually. We are excited to continue this next year. And in fact, Josephine, we are excited to welcome her as one of our scholars that's coming in. We also use this to help foster research activity, not only education activity. And so the McDonnell Academy, as well as an Africa initiative we started a couple of years ago, has over the last 2 years promoted research partnerships with seed funding. And so these are a list of some of the seed funding programs that we supported and across multiple places on the continent. And we were really excited that these are starting new projects across all different disciplines to help really solve some of the world's most pressing problems. So let me unscreen share here. And with that, what I'd like to do is close out and just again thank the Smart Africa Center for this important conference. Thank all the people for being partners of Washington University and collaborating with us to really help solve some of these important problems. And I invite you to help us identify other ways beyond the work today that we can partner with you to solve these problems. thanks again. Have a fantastic day. I followed some of the posters that you have, which look like it's really important work and really interesting work. So I hope you have a very enjoyable day, and we hope to be able to see you on the continent soon.
Thank you. Kurt, you are so welcome in our next meeting on the continent to join us. And we so appreciate the collaboration and the support. There's so many initiatives that we have started together and that look forward to working with you and your entire team. Thank you for all the support that you've provided, and I appreciate your welcome remarks. So with that, Josephine, I believe I turn this over to you. And so if you could kind of guide us to our next phase of our welcome remarks, I would be grateful. I do want to make one word of mention. Many of you will see both Josephine and William all day, but to acknowledge some of our other important colleagues who will be on the panels, but also Dr. Fred. You'll see he is the director of ICHAD and I'm the co-director of Smart Africa. Ozge, Dr. Prose, so many people, Betsy and Laura, who have been really critical in creating this conference, as well as a whole planning committee. So Josephine, I turn this over to you. Thank you for all your efforts.
Thank you so much, Dean. I think I take this opportunity to welcome Dr. Fred to take over the next lead. Thank you so much.
Thank you so much. Good morning, good evening, good afternoon, wherever you are. Thank you so much, Dean Mary McKay, who is my dean and my co-director for Smart Africa. And thanks so much to Vice Chancellor Kurt for those excellent words. So it's my pleasure and really privilege to invite a person I call a colleague, but also who is our program official, who is always there for us, trying to do the same things that we are doing here at Washington University, building capacity of young scholars interested in research. And that person is Dr. Geetha Bansal, who is a program officer at the National Institutes of Health. Dr. Geetha has a long bio, so I would encourage each one of you to go online and read it, but I will highlight a few parts here. Dr. Geetha received her PhD from the University of Maryland in immunology and biochemistry. She did her postdoctoral work at the US National Institutes of Health in Maryland again. And then she spent 8.5 years as a scientific review officer and as a program officer in the Vaccine Research Program, Division of AIDS at NIDA, at NIAD, my apologies, and she gained valuable experience in NIH extramural grant processes, overseeing research portfolio in basic vaccine discovery for HIV. After spending that time at NIAID, she joined Tulane University, where among so many other positions, she was the Associate Dean for Research and Faculty at the School of Public Health and Tropical Medicine in Tulane. She worked on malaria vaccines as a faculty there, and she also initiated interdisciplinary programs and support for NIH grant writing. So we have no better person to be really giving a talk to us around capacity building on the continent, both to upcoming researchers, mid-career researchers, and also people who are interested in submitting grants around training a new cadre of researchers. Dr. Geetha, as I call her, returned to NIH in 2017 as a program officer, and she currently oversees the HIV/AIDS research training portfolio at the Fogarty International Center. So thanks so much, Dr. Geetha, for doing this, and the floor is yours.
Thank you, Dr. Fred. I am trying to share my screen. Hope you can see it.
Yes.
Yeah, I can see that it's if you want to put it in sharing more, yeah, thank you.
Okay. I have to go back. There we go. Thank you, Dr. Fred, for those kind words of introduction. And I want to also thank the organizing committee for inviting me to speak at this really exhilarating meeting. I was listening to most of it yesterday. So today I will try and do my part to make it more useful for you all with respect to the programs and grants and so on and so forth. So having been introduced already, you all know my name. I just wanted to take a few seconds to introduce the Fogarty International Center. This is one of the 27 institute centers and offices, and we are very, very used to using acronyms here. So when you hear the word ICO, it means Institute Centers and Offices at the National Institutes of Health. And the Fogarty Center is one of those 27 institutes at the NIH. And we are solely focused on international activities. And as I'll show you here is where we sit. Hopefully you can see my pointer. This is the Division of International Training and Research. The Fogarty International Center is really a very small part of the NIH. We are the smallest institute, I think, the center. And we also have a very, very low budget, but our reach is really far and wide across the globe. So we handle all of the extramural grant portfolio at the National Institutes of Health. And the mission of Fogarty, I'm really having to just give you the main meat of everything because I had to cut short. I have a lot of slides to go through. The mission is to support and facilitate global health research conducted by US and international investigators in partnership. So we want to build that partnership between the health research institutions and the researchers and train the next generation of US and international scientists to address global health needs. And by training the younger generation, we also would, we are trying to sustain this collaborative work. So we recognize that to build this robust capacity of research internationally, and right now we're focused on the LMICs, that we need to develop leaders in the field, and that requires well-trained individuals. We need protected time to conduct research at the LMIC institutions, and also want to do this with strong mentorship from both US and experienced US investigators who are experienced in the LMIC setting and LMIC investigators in collaboration. And in order to do this, we have several, we start very early. We start at the doctoral and the pre-doctoral stages. So we go all the way from the graduate level through the postdoctoral program and into the career development, and later on move on to the RO3, RO1s, and so those becomes the independent research careers. And in doing this, we have several mechanisms in place. We start with the training programs that are under here that are called the D43s and the Global Fellows. That's also a D43. And I'll explain to you a little bit more what exactly these mechanisms mean. And then from here, which is where many of you are, you join Dr. Fred's program, right? You get your degrees and then you move on to a career development, which is a mentored program through which you learn to be independent researchers. And once you get to that point, then you can go on to the points over here, which is writing your own independent grants. So the FIC was established in 1968. That's about 50 some years ago, and the budget was very low. It was about $500,000, which is almost what an RO1 costs these days, right? And the mission was to build a robust global health research workforce and via training and career development programs. So the extramural HIV/AIDS training program that was begun in 1987, and that was our very first concerted effort put into training programs, and that established the groundwork for all the subsequent training programs that we currently have at the NIH. So The D43. So these are some of the grant mechanisms. I can't see the heading on the slide, but the title, but you can see it. This is called a grant mechanism, and there are three or four different grant mechanisms that we use for our training programs and the research programs. Most of our programs are training programs, and what you normally hear are the D43, the International Training Grants. It's a mechanism. This is when you hear D43, you know that it is a training program, and it is can be applied to by US or LMIC institutions and the PIs from those institutions, and it is to support scientific leadership and research expertise at the LMIC institutions. So all of the trainees have to be from the LMICs, and the projects have to be focused on the LMIC science. The next one is the D71. It's again a grant mechanism, but normally we also call that a D71 program, but it's actually a grant mechanism. It's a planning grant for the LMIC. So for those of you who are senior enough, so the D43 and the D71, all these that I'm describing are for very senior people who are able to take on the job of mentoring and establishing, degree programs and so on. So mostly it's the senior investigators who would apply for these. The D71 is a planning grant to do work or to develop a training program. So the D71 helps you write plan a D43 and then finally write a D43 grant application. And this is the PIs have to be from the LMIC institutions. And when is this used? This is usually used when you're starting a new area of research. So you may be an HIV NCD person, but you suddenly want to start focusing on cancer or something like that. And so you would then try to get one of these D71s, and during the 2 years that this program is allowed for, you would then bring your teams together and try to develop a D43 for a cancer program at the end of the 2 years. We also realized that in order to do good research and high impact research, there needs to be an infrastructure, the facilities for grant writing and for management of grants and so on and so forth. You need libraries, you need various different support functions, and that is obtained through a G11 mechanism. And this is called the Research Infrastructure Grant program. And this is again applied to by senior level or mid-career level investigators who think that they can help the institute get some infrastructure to continue to do good research. So this would be Research Administration Office, the library system, the communication system, and so on and so forth. So I have not, for the want of time, I have not put all this in, but I can take you through when you will, where you will be able to find the information. And I'm also addressing both the trainees as well as faculty with the presentation I'm doing now. So the other thing to remember is if you are doing HIV/AIDS research, they all have to follow the NIH HIV/AIDS priority research areas, and that is given in this notice. I put that up so that you all can make sure that if you are applying for HIV/AIDS, they need to fall within the high and medium priority areas for us to be able to use the funds well. Usually we get our funds separately from the Office of AIDS Research, and so we want to be able to maximize that contribution. Another program that we started apart from the D43 is to link the training program with an NIAID longstanding program called IDEA. It stands for International Epidemiology Database to evaluate AIDS. And that program has been going on for a long, long time. And what I thought when I came in, I noticed that they were they were going to be able to help us, or the partnership would be very good if I could engender that. And it will provide for training opportunities to help trainees develop skills and in study design, in data management, analysis, interpretation, dissemination, all of those things that you all do in a way, but you can get some accelerated training through this partnership program. This was just established in 2019, and they have been renewed now for another 5 or 7 years, I don't remember. So we will be starting our D43 partnership with them very soon. And so this is, again, you can find this on this link that I provided on the IDEA website, as well as on a lot of information is already available on the Fogarty website. So now that we have done the early career through the D43s and through the FIMP programs and so on, you're now going into the career development, which is once you get your PhD, you are still not quite independent, but you can go through these mentored career development programs. And these are the two mechanisms that we have. These are grant mechanisms, again, the K01 and the K43. These are available to those of you who have finished your degrees, you want to continue in research, you get a mentored time of 5 years with some senior investigators, one from the US, one from the LMIC or the institution where you're going to be working. The work has to be done at the LMIC, and you learn how to conduct independent research slowly. So this program has been longstanding. It's been going on since 1999. The K43 program was started in 2015, and the difference between the two is, well, is in the next slide. And all I show here is some brief differences. And the K01 program is for US citizens, permanent residents that want to work in a global setting and are able to spend about 50% of their time working in the LMIC institutions. And the K43 program was begun in 2015 just to be able to give the non-US citizens, the investigators or the trainees from the foreign institutions an ability to be able to train similarly as a K01. And when we combine these two, so you have the young investigators in the K01 program, and you've got the K43 investigators who work in the LMICs. When you combine these two, you can strike up a very good partnership and make your own collaborations and your own career path by building on this relationship. So more about that will be available in the FIC website. So what topic areas do we work on? I mean, for Fogarty, any scientific area that is of a priority area in the LMIC and has its scientific importance for improving health, you are valid. I mean, you could apply for pretty much anything. That's the one good thing about Fogarty, is that we are not constrained or restricted by, a particular disease or a particular disorder, because we can pretty much do everything. And a lot of the times we jumpstart areas in many different, I guess, not taken up by the other institutes. So we are able to do that. And I've just listed all the different areas of research that are available. This is just some of this. So I also, this is the best time for me to acknowledge all our NIH ICAO partners who co-fund a substantial amount of our program. Without them, we wouldn't be able to have this kind of reach, because we obviously need money to be able to fund more grants. So I really want to acknowledge all the other ICOs. I'm not naming any because there's just many of them. And then once you've done that, you got to the career development programs, now you're ready to apply for independent research grants, and those would be the R categories, like the R21s, the RO1s, and so on, right? And so for that, what we'd like to do is initiate, the goals of this program is to initiate, obviously, new research. So here are a list of what we aim to do. We want to catalyze research by providing opportunity to initiate new research. We want to fill gaps in the areas that are important scientifically and in terms of human health around the globe, obviously, but definitely in the country where you're working. We want to develop research capacity. This is our main focus, is to develop the research capacity focused on not just HIV. This is coming from my program, and I did not want to take the assume that I can talk for every other program, but basically we all in all our programs want to do the same thing, and we want to be cross-cutting. That means promote more interdisciplinary work and partnerships across the globe, across the countries on the continent. So now I want to tell you a little bit about, these are the confusing things that I want to make sure that everybody understands. This is an FOA mechanism. So the funding opportunity announcement is the what you read and what you want to apply to. Previously, I talked about the D43 and the D71 RO1s. They are all called grant mechanisms. So a funding opportunity mechanism is listed here. Normally, you would see a PAR dash and either an institute or something like that, followed by some numbers, right? That's what you normally see. That is a program announcement, and a program announcement is usually designated by a PA. And these are all nothing but the funding opportunity FOAs that you see on the websites and so on. The PAR is actually a program where the institute, rather than the NIH Center for Scientific Review, reviews their own applications that come into that program. A PA is more wide, and many of them go to the Center for Scientific Review at the NIH. And why I'm telling you all this is that when you see a PAR, you know that it is most likely going to be for 3 years. So if you missed applying this year, you can apply next year and the following year. And a PA is also like that. It stays for a long time. And that is generally for an investigator initiated. You want to write an RO1, you just want to know which institute to go to. You can just apply to that particular FOA. The availability of supplemental funding, and sometimes, when you have a grant and you realize that you need a tiny little bit more money to do something specific, those are usually available through supplemental funding if the institute has it. And those are usually, they come out as a separate announcement, and those are usually called notices, and you would see the term NOT. When you see an NOT, don't assume that it is a grant, that you can apply for a grant through this. It is not. You already have to have had a grant or have a grant, and then you apply for that extra bit of money. We currently, I think you are all seeing a lot of information on NOCs, right? You hear about NOCs this and NOCs that, and what that is actually a notice. It is a notice just to let people know that we are interested in some specific areas. For example, in this time of COVID, we saw a lot of NOCs coming out because nobody anticipated that, that we would have to do so much more work with COVID. So you would see a NOC that says, this institute is especially interested on COVID-19 whatever, diagnostics or therapeutics or whatever. They would then say, you can apply to this NOC through some other grant mechanism, a PAR or an RFA or something like that. So when you see a NOC, you want to make sure that you read what it is attached to. It needs to be attached to some D43 or some RO1 or some R21 or something like that. Only then you can apply for it. These will be confusing, so please make sure you can ask me questions if we still have time. Then we have what is called an RFA. That is what most of you are familiar with. It's a request for application. Usually it is very targeted to a specific scientific topic area. And it's usually one time, and sometimes maybe, they can do this for 2 rounds. You also have something called an RFP, which is mostly for contracts. It's not something we always do. It's very different from a grant, and it's very prescribed. So if you're doing diagnostics and you're going to do this as a service for a lot of people, then you would do this through an RFP, which also is something you respond to. And I already told you about notice. The other thing about notice is that whenever there are policy and procedural changes at the NIH to an RFA or a PAR to any of our programs or policy changes, they come out as a notice. So you would want to watch out for the NOT and make sure that even when you're reading your RFA, when you're applying for grants through a PAR, RFA, or any of those things, if it gives you an indication of notices, please make sure you read them because you will miss valuable information. So I cannot read what it says up on top here because my screen is blocking it. The funding opportunity announcements and information that you want to get. I think what follows now is a lot of web links that would be helpful. So if you want to really be abreast with what NIH programs and funding opportunity announcements are, you subscribe to this weekly guide. And it every Friday at 3 p.m. Eastern time, they come up with all the new listing of all the FOAs that are available to the public. Also, if you want to subscribe to the Fogarty website, well, I think you should, and not if you want to, because here too, we give you all of the information about all, sometimes we also put in information on FOAs that are available to the international institutions. So we select them and put them onto this. So you might want to do that. I've provided you some more information on where you can get information on how to write your grants properly, what should be included. I highlighted this mostly for the senior investigators. This was a notice we just got 2 or 3 days ago about everyone who's considered to be a key personnel on your grants have to have an ERA account. So make sure that that is something you're beginning to work on. I also have some information here where if you're an international grantee, the kinds of application processes that you need to follow. You will definitely do this not as an individual, but through your Office of Research Administration. The grants policy manual gives you information on how you can spend your money, what is the right ways to spend your money, etc. And then this is another one that I would say was a very good thing to subscribe to, Open Mic. This is the website. Mike Lohr is our director of the Office of Extramural Research, and he has a blog site where he talks a little bit more and explains a little bit more about the policy changes and things that are coming up. So these are all some of the things that you should be looking for. Some, again, for the trainees, just some very loose guidance as to what you should be thinking of when you write a grant application. The links are provided here. But one thing I want to tell the career development, the K grantees, if you're going to apply to any of the K mechanisms, the career development programs, please make sure that you have a mentor in the US, a mentor in the LMIC, and that they're both working together and working with you to make sure that the application is written properly and that there's synergy between the three of you, as well as get letters from whoever you are, from these mentors as well as others as the FOA asks for. So if you get into the FIC website and look for the K grant mechanisms, you will find the contact information, but you can always contact any one of us. And because I'm talking to you right now, I'm happy to take questions from you or emails from you, and I can pass it on to the right people. So again, more lists. I think I should not continue on with just telling you about these links. They are pretty self-explanatory, and you should be able to look at them. Lots of information here for also those that are already senior investigators and are writing grants, because there are policy updates and things that people usually don't pay attention to that are in there. The RCR training, especially for those who are applying for D43s and have D43s, the RCR training for your trainees is very, very, very important, and that comes up every year. So please pay attention to that. And the K01 and the K43, here are the links. So you can get more direct information from reading that. And if you don't understand it, you can always get in touch with us. All the trainees, all senior investigators, all the people that are working on grants have to have this ORCID number ID, because NIH instituted this a couple of years ago. And we would want to make sure that all of you have this number, especially if you're a career development applicant and if you're on a K40, I'm sorry, on a D43 training program. So make sure you get that. These are again some more policy things that the other senior investigators can look at, and I will definitely I modified this from what I sent out to the organizing committee yesterday. I will definitely send it out and share this with you, and you have my contact information. So I am done. If you want to ask any questions, I'm available.
Oh, wow, wow, wow. Thanks so much, Dr. Geetha. I mean, we couldn't have asked for, a better person to take us through these different funding mechanisms, especially as we speak to our new researchers and even senior researchers interested.
Can I stop sharing so I can see everybody?
Please, go ahead. So I want to thank you again for having taken the time for a thorough presentation. I just want to give, to let people know that we have several people really who have benefited both from the D43, but also from the K43, and I think Dr. Manasi Kumar is one of the people that have, Kenya.
Hi, Manasi. Yes, I know.
Yeah. So, but there are some questions that people have that I want to highlight a few questions here, maybe if you have 5 minutes.
Yes.
So William and Dr. Vinbwana have a similar question. And the question is, first of all, William and Dr. Bwana, thank you so much for your presentation. And they said that, Dr. Geetha, what advice do you have for junior scholars who have to carefully navigate a considerable lack of funding experience when submitting NIH or another grant, which seems to be a barrier to many faculty in LMICs? Yeah. That's the question Bwana adds on and says, to add on William's question, what in your experience is the most useful approach to grant making by a junior scholar?
Yeah, that's really a tough situation to be into. And it's not just the LMIC scientists who face it. There are a lot more other considerations that limit, that has limitations on junior investigators from LMICs. But it's the same situation in even amongst the U.S. young investigators, which is the grant writing experience, which is why I said going from your D40, while you are in your D43, and Dr. Fred, you have one of those, so you know and I know you're doing all this. But in the D43, most of them are given a grant writing training experience. We have meetings, whenever we have program meetings, we always try to, just like I'm doing now, we try to interject something like that for the junior investigators, bring in your specific aims, think about science a certain way, and we try to do that. And I think through the D43s, that should be done. And it is, you can get all this information from just looking at the website, but that's not enough. You need a mentor. And my appeal right now is to all of you mentors who have written good, successful grants, is to start nurturing these younger junior investigators and need to get there. So once you do that, I think the definite best way to become good, make a career development and writing good grants is go through the career development programs, like the K programs, because there you are still under the mentorship of senior leaders who will help you think about your science and how to project it, how to present it. And so that's the best way to do it. I don't know that I have any other way other than to say you have to put in a lot of effort yourself in reading about how to write good grants and evaluating what you do, read through what you have written, and then make sure you go to somebody who has experience, whether it is your people at your own level. Make sure you find mentors. So I have done this kind of a talk before at Tulane on mentorship, and what really makes a good mentor and what you should expect from a mentor and ask from a mentor. So find a mentor that is able to work with you and work with them to read through your specific game. So always when you contact a program officer, think through your thoughts, write out all your, what it is that you want to do. And as you are writing, you learn how to make sure that it all connects together. And that's the best way, I would say, you learn how to be a good grant writer. The rest of it is up to the study section. If you make a compelling case and you're very clear, articulate, you don't worry about the writing. It's not the English literature that we are worried about here. It's the scientific, you can do this in bullets, think bullets and write in bullets, and then just fill in with a few words here and there. That's the best way, I think, of improving your grant writing ability.
Thank you so much, Dr. Geetha. I think definitely, I always tell my students that unless you practice, my first submission was worse off than my next one. So my next one was better than the first one. So I always tell my team that way.
Yes, and not to worry about all the red markings you see on your first draft. That is totally okay. And you learn this even when writing publications.
Yeah. So
you have to work hard.
Yeah, the other question in the chat is from Dr. Muthoni. And the question from Dr. Muthoni, is just a clarification. And she wants to know whether in order to apply for NOSI, do you have to have a current grant? Okay,
so I'll tell you, you have to have a current grant if your NOSI says that you have to attach it to some, if it is a supplement. Remember I told you about supplements, you can get supplements. You have a current grant and you wanted to add a COVID component because for everybody, COVID is new. So for that, yes, you would need a current grant because you're adding on a COVID component to your research proposal that you already submitted and working on, right? For that, you need a current grant. But there are some NOSIs that would just be attached to the PA. Remember, I told you PA is a program announcement that is for investigator-initiated grants, or a PAR, because that the announcement is already gone out and you can pretty much apply within the constraints of what the PAR is requesting for, you can apply. And if the NOSI says we will, so for example, let me give you a concrete example. That we have a D43 program, it has a certain FOA number, PAR 19-283. Now, if you don't have a grant within that, it's fine. But the NOSI now tells you that we are interested in looking at HIV and COVID related training programs. So now you can attach this. This is just telling you that these are our interest areas from the different ICs. Now you can find the funding opportunity announcement, like for example, the one I just mentioned for a D43, and you can come up with a new. So for that, you don't need a new grant. That could apply to an R21 program. It could apply to anything. So what I'm telling you is you should read the NOSI to find out what it is. Is it for a supplement? Is it for new programs? But they are always attached to some other announcement that is already existing, either a PA, PAR, and RFA is difficult because RFAs don't continue on. So mostly it's to a PA or a PAR. I don't know if that was clear enough.
That's clear. So, but there are lots of thanks in the chat for you. So thank you so much. And I'll just highlight a couple more, just one from our program official, Dr. Holly Campbell-Rosen, that Dr. Gordon mentioned the RFA that an RFA that you highlighted yesterday, and she just put it in the chat. So for the audience to pull up, that's all. But anyway, we want to thank you again so much for the time that you took to prepare and for the time you've taken to present. I know that there are so many questions coming, either through iChat and Smart Africa or directed to you since you gave your email, and we will be sharing your PowerPoint presentation via.
Sure. And my last thing I wanted to say was, I know that this is about child mental health. So we do work with a lot with mental health on the training programs. I have program officers with whom I'm in constant touch. And so in terms of building the collaboration, you are doing it at the level of the PI, and we are doing it at the level of the ICs to make sure that Fogarty can jumpstart certain things, but we cannot do RO1s. We cannot, run these bigger programs, but we also don't want to do this because the other ICs have the topic area. So we work with them. And so again, I do appreciate everything else that the other ICs are doing to make sure that we continue to do what we need to do. Thank you all.
No, thank you. In fact, our D43 with Dr. Noel Nakasuja at Makerere and Dean Mary McKay and myself is co-funded by you and NICHD. So yeah, there is that collaboration that goes on. So thank you so much again. And
You're
now
welcome.